We saw that heart there on the screen, and you know February is Heart Health Awareness Month. It's a time to take action. Why, you ask? Well, heart disease is the leading cause of death in the United States. It's a statistic put out by the American Heart Association, and tonight we have Gina Kloft, the local division director, here with us in the studio. Gina, thanks for being here.
Thanks for having me.
Yes.
Obviously, heart's on the minds of many here over the next couple of days. If folks are maybe concerned, maybe haven't had a checkup in a while, and they're wondering, should I get my heart checked? Yes, of course you should, but what are some signs and symptoms to be aware of?
So obviously we want someone to see their doctor at least annually, but clearly knowing your family history is one of the most important things that you can do. And in addition to that, really looking for those signs and symptoms, the extreme fatigue, right? The heaviness in the chest, the jaw and neck aching. But for women, the symptoms often look different, right? We don't traditionally always have those movie star symptoms that you might see with men. So that is why it is the #1 killer of women, unfortunately. So we're doing a lot of education this month, and we're really proud of that work.
Well, we want to show on the screen some reminders that you have. And these are 8 steps, as you can see here, to prevent not only heart disease, but stroke as well. Gina, talk us through what some of these important points are.
A few years ago, our organization sort of reimagined what our Life's Simple 7 looked like, and now we have this Life's Essential 8. So it is these 8 areas that we really want you to focus on to reduce your risk. Clearly, we talked about the first one, right? Knowing your risk, knowing your family history, really empowering, right? And discussing that with your healthcare professional. Eating a healthy diet, not always easy to do, especially tomorrow with all that delicious chocolate I'm sure we'll have, but everything in moderation, right? And then of course, moving more, being physically active. One of our favorite things to do in the community, especially as spring is here, and we've had this fantastically warm and mild winter, so getting out and moving more. Something as simple as walking can have great benefits for your heart and brain health. Of course, watching our weight, right? So eating healthy, moving more, those things help us manage our weight as well. And then of course, being tobacco free. We're hearing a lot more about adult smoking being down some 49% in this country. However, tobacco through youth, vaping and e-cigarettes, a big problem. So talk to your kids, educate them, know the warning signs as well. And then managing your conditions. That's really like talking about knowing your numbers, right? Are you managing your conditions through things like medication therapy or diet and lifestyle? Always taking your medicine, right? Really important. Never cutting it in half, skipping a dose, or quitting your medication without consulting with your healthcare professional. And finally, being a team player. I love the whole fact the whole family being involved, our social units, the friends that are in our lives, really inspiring them to make healthy choices too.
And we have a lot of tech tools nowadays to help us track our heart health, from watches to different things, and those come into play too.
It's never been easier. It's never been easier to take care of yourself, and yet people don't.
Fantastic. This generation, our generation, and the next is so blessed to be able to have this technology. Obviously, the American Heart Association has some great tools, some apps, some resources on our website. Everything is at our fingertips now, right? Whether it's a phone, a laptop, making a phone call, we're there for you at all times.
Gina Kloft, thanks so much for joining us. Take
Thanks
care
for
of
having me.
yourselves. Get your hearts